It's my honor to be here with you all. Thanks so much to the whole team at Health for the World for this kind invitation. I'll be speaking today about improving end-of-life care in emergency medicine. I realize that emergency medicine means a lot of different things to a lot of different folks around the world. It's a relatively new specialty in the United States. It's rather than an organ system-based specialty like GI or cardiology, emergency medicine is the treatment of acutely ill and injured adults and children, and a body of knowledge that recognizes a special set of differentials and interventions and treatments that are limb and life-saving for folks who come in at the very beginning of a traumatic injury or an illness. So improving end-of-life care in this group of patients is very important. You can imagine that with such high morbidity, injuries being coalesced into a single emergency department to provide care, there's going to be a lot of opportunity for providing excellent end-of-life care. So a little bit about me. I am a lecturer for the EPEC-DM course, which you're going to hear a lot about during my talk today. It's the Education of Palliative and End-of-Life Care in Emergency Medicine certification course in the United States. But I'm faculty at Stanford University in the Department of Emergency Medicine, where I serve as the Vice Chair of Education, overseeing our student and resident and fellowship programs, and working closely with the folks who put those programs on, conducting primarily education research. I'm not a palliative care boarded specialist in the United States. I do what's called primary palliative care, a term that hopefully we'll define as this hour goes along. I do have a couple of disclosures. In addition to being faculty with the EPEC-DM project, a certification course that I'm going to talk extensively about during this hour, I also held a grant from the National Institutes of Health in the United States, from the National Cancer Institute. And many of the slides that you're going to see today are a result of that grant and the funding that we received from the NIH. And I do attribute a lot of this work that I've done to that grant, and I want to give thanks to the National Institutes of Health for sponsoring.